And a reminder of another top story this hour. The Philippines is rolling out a campaign to stamp out polio. The re-emergence of polio in the country follows two other different outbreaks earlier this year.
Measles and dengue fever have killed more than 1,000 people since January, most of them children. The measles outbreak in particular has been blamed on a growing hesitation among Filipino parents to get their children immunized.
Public trust in vaccines first broke down following the controversy over Dengvaxia. In 2016, the Philippines became the first to use the dengue vaccine in a trial program involving hundreds of thousands of school children.
But a year later, French manufacturer Sanofi said that the vaccine could worsen symptoms for people not previously infected with the virus. The disclosure sparked nationwide panic, with some parents blaming the vaccine for their child's death.
The country's health department has since admitted it continues to struggle with vaccine hesitancy. So for polio, the recommended rate of immunization is 95% of the population to ensure herd immunity against the disease. But polio coverage in the Philippines is well below that, only at 66% last year, the country's lowest rate in a decade.
The Philippines now finds itself back among a small list of countries that still need to deal with a debilitating disease for which there is no cure. Afghanistan, Nigeria and Pakistan are the last three countries where the disease is endemic.
Wild polio virus type 2 was declared globally eradicated in 2015.
Now, for more on this issue, we're going to be speaking with Zafrin Chowdhury, Chief of Communications for UNICEF Philippines. She joins us live from Manila. Zafrin, so the Dengvaxia vaccine scare was blamed largely for the fall in immunization rates. What can authorities do to get things back on track?
Actually, the Philippines has been at high risk for polio for a few years. As you have just said, the vaccine coverage, the immunization coverage had fallen to 66% last year, and it had been steadily declining even before the Dengvaxia scare started. Of course, then the dengue vaccine scare further contributed to lowering trust and confidence and added to the vaccine hesitancy. So, it's really, further contributed to the decrease of vaccines. It's also probably part of the global decline in vaccine and, rise of anti-vaccine sentiments that affected the Philippines. So all these factors put together has caused a decline in vaccination and immunization coverage, which has now contributed to the re-emergence of polio, which is a very, very worrying development. UNICEF, we are very, very concerned about what its impact will be in child health unless this is contained fast.
Well, are there other factors that might have contributed to this re-emergence of polio in the Philippines?
There is, among the other factors would be poor sanitation, open defecation, or lack of poor sanitation and hygiene practices. This is something that spreads through fecal and through oral means. So there is an environmental factor. When the immunization coverage is low, it's not as high as 95%, then the population does not have the means to withstand the environmental factors. They are more susceptible, more vulnerable to it. So poor sanitation and hygiene practices, of course, contributed further to the situation as we see it.
And what would be the worst case scenario then if this disease is not swiftly contained?
The worst case scenario will be to more children to be infected. As you know, it really mostly affects under 5 children and rarely adults or older children. So more children can be affected. This is, in the worst cases, this can cause paralysis. This can cause, conditions that are difficult to treat. But we are really hoping that we don't have to go there. And we are working, UNICEF and WHO are working with the Department of Health to really boost immunization coverage and up to 95%, because every child, there should be a strategy that in place, a response strategy that will emphasize and make sure that every child is reached. Because as long as one single child is left with polio, then other children are not safe, not in the Philippines and not beyond borders. So that's really the emphasis that we have to reach. The government will have to reach every child, every corner. There are some geographical challenges also, far-flung areas, islands. We really need to have a strategy and an action plan in place that covers, through several rounds that are already now planned, all the children will have to be covered.
So very quick
under immunization.
Well, very, very quickly now, aside from boosting this immunization, what more should be done to actually stop the spread of polio and other vaccinable diseases then?
Vaccination is the best protection, as you know, to preventable diseases against polio. This is the best protection we can give children. In the interim measure, we are also asking to wash hands, use toilets, eat very well-cooked food. But these are interim measures. Vaccination coverage is the key. And along with that, UNICEF and WHO are supporting the government in social mobilization and community mobilization. Really, the raising the trust and confidence in vaccine is a key factor here, through interpersonal communication, through social mobilization, through media, with the help of local influencers, the local government. We are really, suggesting and recommending and exploring all means and forms that we can use to increase the immunization coverage. And we want to get to a position where the efficacy of vaccines, for its unique role in keeping children safe against preventable diseases. That's the message we are trying to give to every parents, caregivers, local government, so they voluntarily bring their children to vaccinate, to immunize.
Thank you so much for sharing your insights, and that was Zafrin Chowdhury, Chief of Communication for UNICEF Philippines.